Thank you very much, Brian. Thank you all for coming out tonight, and thanks to Rockwood Bank for having me out. I greatly appreciate it. My goal tonight is to basically give you a good understanding of the law and a working knowledge of it. An hour obviously is not enough time to become an expert in the law. It's too vast. And frankly, anybody that claims to be an expert in the law, you might need to take with a grain of salt. So I definitely won't tell you that I'm an expert, though I do spend basically every day working in the health insurance arena. And so since 2010, this has become basically a part of every day. But what I really want to talk about tonight is how healthcare reform impacts individuals, and we'll drill into how it impacts different individuals differently. So if you have questions as we go, please let me know, because everyone obviously has different circumstances. But what I'm going to try to do is give you a few points to take home with you, so that you'll be able to have a basic knowledge of how this law will impact you. Okay? So what is healthcare reform? Healthcare reform is a law that was passed in 2010. And basically this is an insurance law, a tax law, and an employment law. So this is going to pull in a lot of different areas and a lot of different expertise to really get a handle on it. The law requires most individuals to obtain health insurance. It requires insurance companies and employers to provide consumers with a different type of health insurance that they've had in the past. So what I'd like to do today is talk about who has to have health insurance and what types of insurance are going to be sold going forward. If you could take one thing away from tonight, it's that you have to have health insurance coverage. So this is called the individual mandate. It requires you to have at least minimum essential health coverage. And we'll drill into what minimum essential coverage means. Basically, anybody that does not have health insurance after this last year is going to be faced with a tax penalty. So that is what people refer to as the individual mandate. Minimum essential coverage can come in many different forms. You can get coverage through your employer, which is probably the number one way, through a state entity such as Medicaid or Medicare. CHIP and TRICARE are state and federal programs that also count as minimum essential coverage. And then also Peace Corps volunteers and marketplace and individual plans, which we'll talk about primarily tonight. Minimum essential coverage has to have at least the bare minimum benefits that are prescribed by the law. And there are 10 different categories of essential benefits. Preventative benefits is probably the one you hear the most about. All plans have to cover preventative under the law. There are many types of policies that do not cover the minimum essential benefits. Dental, vision policies, and certain standalone policies do not. As far as penalties go, that for those that do not have minimum essential coverage, the tax is a graded tax. Each year it's going to be an increasing level. Last year, if you did not have health insurance, the tax was either $95 per individual or per adult in your family, or 1% of your income, whichever was greater. So if you make, let's say, $30,000 a year, your penalty would be 1% of that, which is $300 per year. This year, it's gone up to 2%, or $325 per adult. And next year, it'll be 2.5% of income. So basically, each year we have a graded higher tax for not having affordable coverage. So if you're offered coverage through your employer and you decline that coverage, or if you're not employed by a company that offers coverage and you choose not to buy an individual policy, we're going to face a penalty at the end of the year. So this is where we're pulling from the IRS, as well as the Department of Labor, to determine who has coverage, who has minimum essential coverage, and then who's going to owe a penalty at the end of the year. The reason behind that, this is one, we'll skip that one. The reason that you have to have individual coverage is that the law is designed to get everybody covered under some type of plan. To do that, we have to have what's called a shared risk pool. So basically, we have to offer coverage. If you can't have anybody uninsured, if you have anybody that's uninsured, you have to have a penalty to push them into a pool. Basically, what they're afraid of is that you're going to get offered coverage to everybody, and then the people that are healthiest won't want it. So if you have two different systems, basically rewards and penalties, to drive people into plans, that's how you're going to get coverage across the board. And that's really the design and the intent of the law, is to basically get as many people covered under some type of plan as possible. And the real mentality there is that you're going to get some kind of reduced cost if you spread that across everybody, as opposed to only certain groups having insurance. There are certain exemptions, so not everybody has a penalty for not having coverage. The list is fairly short, and it's primarily listed as people that are excluded due to income returns, having a very low income. They're not filed to file a tax return, or they may qualify under other programs such as Medicaid. So there are exceptions where you would avoid a penalty if you don't have a health insurance, but for the most part, everybody in the United States will have to have health insurance starting as of last year. These are a few of the circumstances where you might be able to file for an exemption: bankruptcy, homelessness, death of a close family member. So these are basically hardship exemptions for people that can avoid having coverage. So the first thing I mentioned, you have to have coverage. That's important. The second thing is that how you get coverage and the rates are different than they ever have been before. So has anybody ever gotten an individual health insurance policy in the past? Okay. So you had to fill out a lot of questions. You had to answer have you ever questions, health medical questions as far as pre-existing health conditions, maybe prescription drugs. And the company was going to look at those health conditions and rate your policy based on those answers. So that has completely changed. So as of today, if you go to buy health insurance, there are no medical questions for any individual policy. So everybody gets the same rate regardless if you're sick or healthy. That's a huge difference from what we had before 2014. The second big difference is there are no gender ratings. So in the years past, if you were a young female versus a young male, there would be a very different rate because obviously maternity is a coverage that is quite expensive. As of 2014, a male and female at the same age have the exact same rate. And that applies to all individual plans as well as small group plans. Quick note on that. I'm sure, are there several people that are covered under group plans in the room? Okay. So group plans have been defined by group size. And as of this year, if you're in a group of under 50 participants, that follows what's considered small group rules. And the individual rules and small group rules are very much in line. Next year, that goes up to 100 lives. So nationwide, quite a few businesses are going to be in this rule, this section of rules that are going to be under 100 employees. All of them will have no pre-existing conditions, no gender rating, so male and female will no longer matter. And then the age is going to be compressed into what's called a 3-to-1 age band. What that means is that if you are a 22-year-old and you have a 64-year-old, their rate has to be within 3-to-1 of one another. So if I'm 22, which I'm not, but if my rate is $200, the most that the insurance company can charge a 64-year-old is $600 for the same plan. In the past, a 22-year-old male might have had a $80 rate and a 64-year-old male might have had an $800 rate. So that's a 10-to-1 spread. So what we've done is go from 10-to-1 down to 3-to-1. Male and female come together, and sick and healthy come together. So we're getting a compression of rates from all different types. What that means to you can vary depending on where you were and where you're going to be going forward. For example, if you were a young, healthy male and you were paying $80 on an insurance plan before 2014, your rate is going to go up because of healthy and sick together. It's going to be going up because of male and female together. And it's going to be going up because of the age banding together. So you're going to get triple hit. So a young male's rate might have been $80 2 years ago, is probably closer to $250 or $300 today. So that's almost a 300 or 400% increase in rate. On the flip side, if you were a sicker person, closer to 64, and were paying a very high premium based on your health in the past, your rate might come down. So there's essentially different impacts depending on what side of the spectrum you were on. Same is true if you're on a group plan. If you were on a small group plan versus a large group plan, that can impact you differently. So large groups have largely been avoiding the negatives of the law so far. Small groups have started to trickle in. So if you have a group of under 50, you're starting to see some of these impacts. And the same applies if you're on a group plan as if you're an individual. If you're a young, healthy, primarily male group, so think about like a mechanic shop where you've got mostly people that are male, mostly going to be younger workers and typically going to be fairly healthy. Their rates are going to go up for all three factors. If you've got an older office that had a lot of health claims, rates are actually going to come down. So it depends on which side of the spectrum you were on before. It depends on how the law is going to impact you going forward. Talked about a few of those. You can still get a minimum essential coverage from the same types of places you could in the past. Those are primarily employer-sponsored plans, parents, spouses, or domestic partners plans. Now we've added the health insurance marketplace as a new place to get a plan. You can still get plans direct from insurers. And then COBRA and some state and federal programs are still available. We'll go through a few of those in detail. Really what we're focused on is health insurance marketplaces and direct to insurers as the two primary ways to get plans as an individual. As an employer, from an employer group, that's really a different type of insurance. And I know that if I talked about all of them tonight, you guys would walk out in the middle of the room at some point. So we'll focus on individual for the rest of this presentation. So when I say marketplaces, and please, if I do say anything that's an acronym or a term that's not familiar, please ask, because I get used to doing this all day and forget that some of these terms are only exist in my office. So if I say something that doesn't make sense, please let me know, because a lot of this is new language. When we talk to employers about this, we hand out a 4-page glossary of new terms that have been invented since the law was passed. With over 2,000 pages in the law, and so far over 10,000 pages of regulations that explain the law, every day new terms come out and the rules change. On that note, it's expected that by the end of the implementation of this law, from 2010 until whenever that occurs, there will be over 1 million pages of Department of Labor and IRS regulations that are written to explain how the law should be implemented. So obviously, when I go back to talking about being an expert, the size and scope is basically makes that impossible. So what are the health insurance marketplaces? The marketplaces were originally called exchanges. So you might hear exchange or marketplace. They're essentially the same thing. These are markets to buy health insurance. And the biggest one you'll see is the healthcare.gov marketplace. This is the federal marketplace where you can apply and purchase policies through a variety of health insurance companies. Myth number one that I get all the time is that the plans on the exchange are no good, or those plans aren't, my doctor doesn't take any of the exchange plans. Those are myths in that the plans that are sold on the exchange are often from the same insurance companies and the same providers that are available direct to the insurance companies. So the marketplace of the exchange is really just a portal to purchase those plans. What's unique about the marketplace is that through the marketplace is the only place where you're able to get a tax credit or a subsidy to help you pay premiums for those plans. And I'll drill into exactly who can get those tax credits and what plans they apply to. So basically, they build it as an orbits for health insurance, where you can go on and you can search based on your age and your area, all of the plans that are available to you, and try to get a plan that works for you. So at the end of the day, when you hear marketplace or exchange or healthcare.gov, it's really a website that is a portal to purchase plans. And you can purchase those directly through that portal or through the advice of somebody like myself or through a federal employee that's a navigator. And we'll talk about those outlets as well. A few dates to be aware of. And this kind of goes back to what's changed in these marketplaces or health insurance, the health insurance world. It used to be that if you came to me on any day of the month, I could sell you a health insurance plan that started probably the first of the month following. That is no longer the case. So if you picked up the phone and called me today and said, you know what, I haven't had a health insurance and I know there's a penalty if I don't buy it, I'd like to sign up. I cannot sell you a health insurance plan today. There has to be a reason or an open enrollment period to purchase a health insurance plan. That applies whether you're going through the exchange or direct to the insurance companies. The dates for February 2015, the dates were for 2015 were between November 15th and February 15th. That was the open enrollment period where anybody can sign up for any plan they want to with no medical questions. For 2016, they've changed a little bit. It's from November 1st to January 31st. This is very similar to what you've experienced in the past if you're familiar with Medicare. If you have a parent or if you've gone through some of those election periods. There's an open enrollment period each year where you're able to select a plan and switch. Again, the reasoning here is that if I don't have to buy health insurance until I get sick, that raises the rates for everybody. If I have to buy it during a specific time, then that kind of that makes the playing field even. That means you can't go uninsured until you get sick if you can only buy it during the open enrollment periods. The exception is during a special enrollment period, and that can be basically similar to a qualifying event that you have at work. So if you lose coverage, let's say you lose your job or you retire, and you're no longer offered coverage through your employer, that's a qualifying event to sign up for a plan. If you are 25 years old and you age to 26, when a lot of dependents are now going to be dropped from group plans, that's another special enrollment period to sign up for a new plan. Moving to a new area, marriage, divorce, birth, those type of events are all times when you can sign up for a new plan. Okay? So you got two windows. One is during the open enrollment window and one is during the special election periods. Employer-based coverage. So I get a lot of questions about people that are on an employer plan and they feel that they're paying too much for it. There's a cost share where they have to pay maybe half of their premium or they have to pay all of their dependents' premiums. And they want to look at the options on the exchange. As a rule of thumb, the employer-based coverage is actually going to be less expensive than the exchange-based coverage. The real reason behind that is that for an employer to offer coverage, they have to pay a percentage of the premium. So it's already being subsidized. The second key, and we'll talk about this when we get to the tax credits, if you're offered employer-based coverage, you are not eligible for a tax credit as well. So basically, you can't double dip. You can't get a subsidy from the employer and from the federal government. And we'll get into detail there because that can get a little bit confusing. So shopping for coverage, again, there's two times when you can do it, during the open enrollment period or during a special enrollment period. And that can happen on Marketplace through the healthcare.gov. You can enlist the services of a broker to go out and shop for those plans for you as well. And you have to be shopping in the state in which you reside. So basically, you can't shop across state lines, which is something that people have talked quite a bit about. There's a few reasons for that. One of the primary reasons, and probably the biggest one, is that the networks that insurance companies negotiate are based on the region of their participants. So if you have a plan that's based in St. Louis and you're a New York resident, you're not going to have access to the providers that are in that state. So a lot of people that talk about buying across state lines, fail to realize that the real primary reason is that you don't have access to the providers in other states. For states that have their own health insurance marketplace, you'll go through the state-specific portal. For states that do not, you will go through the federal government's portal. And Missouri is a state that did not elect to set up their own exchange, so you go to the federal healthcare.gov portal if you want to purchase a policy on exchange. This is a map of the states that do have their own state-based exchanges. You'll see the ones in gray are on the federal exchange, and Missouri is one of those. If anybody's in Illinois, they have what's called a partnership exchange, where they have their own exchange that's partnered with the federal government. So there's some variations there. Another main difference. In the past, if you came to buy a health insurance policy, there might have been a 0 deductible, 500, 1,000, could have been an 80% plan, a 90% plan. Whatever the plans that the carriers wanted to design, they could if they thought that people wanted to buy it. So it was essentially open access to any type of plan you wanted. If you wanted to design a plan that had a $20,000 deductible that had very little premium and people bought it, that was great. That is no longer the case. You have to sell plans that fit into one of these 4 metal level coverages. So you have bronze, silver, gold, and platinum. Those are designed to make plans easily comparable, so that plans are going to fit into buckets where you can compare apples to apples. A bronze plan has to be what's called 60% actuarial value. Actuarial value is a fancy way to say that it pays about 60% of the average person's cost. Silver pays 70, gold pays 80, platinum pays 90. So essentially, as you go up the line, you're getting coverage that pays more of an average person's cost. That could be copays, that could be a deductible, that could be coinsurance. There are different ways to get to a 90% plan. You could have a zero deductible and charge 90% of everything, or you could have a $1,000 deductible and then a $1,500 max out of pocket. Those are considered actuarially the same if you run them through their calculators. What that also means, though, which gets to be very important, is that if you have a plan right now that falls between these two, if you have a plan that happens to be an 85% actuarial plan, it can no longer be sold. So the plans, not that they have to be between these buckets, they have to fall exactly in the buckets, give or take 2%. So most of the plan designs that we had in the past that were in no way related to this formula no longer comply with those rules. So one of the major reasons you'll see that old plans are no longer available is that they don't fit into these buckets. There are one exception to that. There are catastrophic plans that are available only to people under 30 years old in the state of Missouri. In other states, it can be based on income. Basically, what those are plans where if you feel like you are invincible, you can do whatever you want, but you have to have coverage to avoid the penalty. You can buy a plan that's very low cost and isn't going to cover a whole lot. It's considered a catastrophic plan. One note on all of these. Currently, the maximum out-of-pocket on all of these plans that any carrier can offer is $6,600. Twice that for families, so $13,200. One of the designs, one of the minimum essential benefits is there has to be a cap on out-of-pocket expenses at those levels. So no matter what you see on any of these plans, that's the most that you can spend on health expenses in a calendar year. So that is one consistency. This is a list, I won't read it to you, of those minimum essential coverages. So there are 10 different categories where all plans that are sold have to cover these things. A few I'll highlight. Maternity is the big one. In the past, maternity was a rider that was added to certain policies. Now it's on all policies. And if you think back to what I said about how policies are rated, if a male and female have the same rate, they're both paying for maternity. And so this is where you'll see quite a bit of speculation or aggravation about older, younger males having to pay for maternity, because it is included on all policies by law. Some of these other ones, preventative, I mentioned before. That's something that basically is again trying to drive down the cost, the overall cost trend of healthcare. And then some of these other ones were kind of added in. So, how do you decide which plan is right for you? And to me, this is one of the things that was the attempt with the metal levels was to make this easier to do. It was the goal was to make plans easy to compare. What we've had is actually a little bit of a splintering where there are variations of the level plans with different network sizes. Some are very narrow networks. Some are broad access where you can go to anybody you want to. And so to me, I won't go through all these, but the first thing you need to consider is the premium of the plan. That is going to be directly related to the benefit level. So whether you're at bronze, gold, or silver, or platinum, your deductible essentially, or your out-of-pocket risk is going to drive the premium. And then the next big variable is going to be the network size. So if you're somebody that has a lot of doctors and a lot of different hospitals, there will be a premium to have access to all of those providers. If you have one doctor and you never really like the guy to begin with, and you wouldn't mind switching, we can go to a very narrow network, and that will save you money. So there's a trade-off between benefit, premium, and network. And those, to me, are the big three that we juggle to try to find a plan that works for you. So I mentioned open enrollment starts November of this year. It's November of this year, and there are a few different ways that you can go to enroll. One of them is through the marketplace. The first thing to do is to set up an account. That is done through the healthcare.gov portal. You have to fill out an online application. That application dictates whether or not you're eligible for either a special election period and or for a tax credit. So that's step one. And then you can compare options, basically like the Orbitz model, where you can shop, put two plans in a basket, compare them, and then select a plan and enroll. You can also apply through the mail, which I would not recommend, and through the help of a navigator or other qualified helper. So I'll give my 30-second commercial there. We're a broker. We're certified to help people on the exchange, and as are the navigators, who are federal employees. So you basically have access to different people to help you select those plans and to navigate this process. My opinion, the reason why I would work with a broker or somebody that's a professional in this industry is that, for one, there's no additional cost to working with us. So you pay the same premium if you work with somebody or if you go it alone. Second, I think that we bring expertise to the plans. We work with these every day, and we can help you avoid pitfalls and also to maximize benefit for cost. Why I would work with a broker instead of a navigator is that we've been doing this a lot longer. My company's been in business 40 years. I'm the vice president of the Association for Health Underwriters. There's hundreds of health insurance agents in the area that have been doing this for 20, 30, 40 years. The navigators have been doing it for 6 weeks or 2 years at longest, because they started when 2014 rolled around. So I think you get a lot more expertise by working with somebody that's been doing it a lot longer. And again, the cost is the same. These are a few of those options. I mentioned the assistance. You can go online, you can go through a toll-free call center, or you can work with a local broker or agent, the federal navigators, and then there are also certified application counselors. So you can go into some freestanding clinics, and there are people there that can help you enroll. Again, for all things equal, if you can get expertise at no additional cost, that would be my recommendation. Okay, so I mentioned before I was going to give you a few takeaways. The first one was you have to have coverage. The second one is that the coverage you're going to be offered is different than it used to be, and the rating is different. The third takeaway is that you may get help paying for that coverage. So if you could leave here knowing three things about health insurance reform, those would be the three. That things have changed. You have to have health insurance coverage. It's not an option. If you qualify for a subsidy, you can get help paying for it. And the rates and the way the policies are issued are totally different than they were in the past. If you remember those three things, we won. Now I'm going to delve into the subsidies, and I will warn you that sometimes this gets a little confusing. So if there's questions, please ask. I'm going to try to stay at a higher level so I don't get too in-depth into the numbers. But what I do want to at least give you a good idea of if you're thinking, maybe I can qualify for a tax credit. Because that, to me, is the first decision. If you're going to sign up for a plan, do I do it through the exchange to get the tax credit, or do I go direct to an insurance company? If you know that you're not going to get a tax credit because you're offered coverage through work or because your income's too high, we've eliminated half the options. And now we've taken half the choices off the table. If you tell me what doctors you go to, we might take off more options off the table. And now we get down to 3 or 4 plans that we can decide between. So to me, that's really the way to go about picking a plan, is to get options off the table. Because if you look at them all at once, there are about 80 plans you can pick from, and it gets to be overwhelming. So who is eligible for a tax credit? The rules are that subsidized coverage is available to some individuals and families with income up to 400% of the federal poverty level. That doesn't mean much to most people. So I will go into the next slide and talk to you about what those numbers mean. There's 2 ways that you can receive benefits from the marketplace. One is a tax credit that helps you pay the premium. A tax credit is a payment from the federal government directly to the insurance company for the plan you've enrolled in. So that is a dollar that goes directly to the insurance company and reduces your premium dollar for dollar. We'll talk about that a little bit more, and we'll talk about reduced out-of-pockets. The big things you need to be aware of. To qualify for a tax credit, you have to have a household income, and you have to file a federal tax return. If you're married, you must file a joint tax return. So you cannot file single and separately and still receive a tax credit. If you're married, you have to file jointly, and I'll explain why in a moment. You are not eligible for subsidies if your employer offers affordable minimum value health coverage. This is very important. The term offer is the first thing I'll point out. So if your employer offers you affordable coverage, you're not eligible for a tax credit. And that's the way the questions read on the application. Affordable is the next thing we'll point out. So again, even if you decline coverage, that offer has been made and you're not eligible for a tax credit. Affordable. The definition of affordable is that the coverage costs you less than 9.5% of your income. So let's call it 10% and round rough numbers. If I make $30,000 a year, $3,000 is the most I can pay for health insurance through my employer. If I'm charged more than that for my own coverage, not for my family, that is not considered affordable and I could still get a subsidy. If I pay less, then that is considered an offer of affordable coverage. As long as the plan meets the minimum value, the minimum essential benefits, there's no tax credit that I can get, okay? Now, let's talk about the family situation, because this is, I think, where I get the most questions and the most confusion. If my wife is offered coverage through my employer, but the employer doesn't pay any portion of the spouse's or dependent coverage, which is very common, I would say that that's not affordable because she has to pay more than 9.5% of the salary. That is not the way the law was written. It is 9.5% of the employee-only coverage, and because the coverage is offered to my wife, the whole family is not eligible for a tax credit. So if you are offered coverage through a spouse and that coverage is affordable for them, that eliminates a tax subsidy for the whole family. So that's an important point. I will summarize this one. This basically, the tax credits are going to be paid in advance, and they are paid directly to the insurance company, as I mentioned. They are also going to be adjusted at the end of the year because your income is going to be unknown until you go to file your tax return for that year. So for example, if I'm applying for a tax credit right now, let's say I just lost my job and I need new health coverage, I estimate that my income for this year is $22,000. And they're going to give me a tax credit based on that amount. If I end up making $19,000, they're going to say, you should have gotten paid more subsidy because you made less than you estimated. I'll get the difference back in the form of a tax refund at the end of the year. If I make more than I expected, they're going to want some of that money back, and I'll owe it back in the form of a tax due. So it's an estimate for the year in which you're getting coverage, which is going to be a rough estimate sometimes, and it'll be adjusted when you file your tax return at the end of that year. There's a second way that you can get health insurance subsidies, and that is through reduced cost sharing. Cost sharing is essentially your deductibles, your copays, your out-of-pocket maximums. So basically, you can either get a tax credit to help you pay premiums, and or you can get reduced out-of-pocket costs on the plan that you enroll in. That is only available if you make below $250,000 of the federal poverty level. And federal poverty levels are listed here. So federal poverty level is dictated based on the household size, so the size of your household. And that essentially is how many people file a tax on the same tax return. So if you are a single filer and you make between $11,670 and $46,000 and you're not offered coverage through an employer, you may be eligible for a tax credit. So these are the ranges of income that you want to be aware of. If you make below $29,000, that's where you might be eligible for reduced cost sharing as well. So that is the 250% of federal poverty threshold. And as you notice, it goes up with the more dependents you have on your tax return. So that the larger your household, the larger your income can be and still qualify for a tax credit. So if you start to really look at the numbers, if you're a family of 4 or a family of 5, you can be close to $100,000 of income and still qualify for a tax credit. So this is not a low-income tax credit. This goes well beyond into middle upper class. So this is a pretty broad spectrum. You know, as you get up to families of 6, basically $130,000 of annual income may qualify for a tax credit. Again, based on the principle that you have not been offered coverage through an employer. So if you're self-employed, retired, in between jobs, these are the income levels that we want to look at to determine whether you're better off to go on the exchange or to go off of the exchange. So these are the big three. Again, you have to have coverage. You can get help paying for it depending on your situation and your income. And the rates and the plans are all new. The way that the plans are designed and the way that the rates are issued and the way that you obtain a policy or even when you can get a policy has all changed. So, really, in my opinion, not much is the same as it was before 2014. And it depends what side of the fence you were on, if it's better or worse. So, to me, it's difficult to give unilateral statements that says the Affordable Care Act is good or bad or it costs more or it costs less. It depends on who you are, where you had coverage in the past, and where you're going to have coverage in the future. So, to me, it requires that each person take a very personalized approach. And again, I encourage you, if you're looking or needing a plan, to work with somebody, whether myself or somebody that has experience in this industry, to help you navigate these changing waters. If anybody has any questions, I'm happy to answer those, and I appreciate your time and energy. So, thank you.
Our tax on the joint.
Yeah, so let's take a question. So the question is about where kids would fall if they're living at home but maybe not on the tax return.
Right.
So there's two things you need to think about there. One is your own situation. So if you were looking for coverage and you have a family of two now, we would look to your income being in this bracket. Now for the kids, if the kids are making some income and they're filing their own tax return, we would look at them as a household of one. So it's very possible that a mom and dad don't qualify for a subsidy because maybe they're on an employer plan or their income's too high, but the 23 or 24-year-old kids do because they work part-time, they work, maybe they're in grad school and they work seasonally, but they make enough income to qualify for a tax credit and possibly get free coverage. So it is based on the way that you're filing. Good question. I'll point out too, notice that these are thresholds, there are minimums. So if you make no income, you are not eligible for a tax credit. The law was designed to send anybody that made below these thresholds to Medicaid. And then the subsidies pick up after Medicaid phases out. Now, not all states, including Missouri, expanded Medicaid. So there is a gap where you could fall. If you live in Missouri, make below this threshold, you would not be eligible for a tax credit, and you would not be eligible for Medicaid in many circumstances. So, the way the law was written and the way it's being implemented has diverged, and that creates some of this ongoing confusion. So the question was, there on the map, there's basically the states that have state-based exchanges, states that have the federal-based exchanges, the partnership models, and the splits. And Utah and New Mexico are the ones that are split. They have the option of both. So they basically are kind of laboratories to determine how state versus federal plans can work better for different people. So they're the odd men out. Well, let me give you my 2 cents on that, and I will give my usual disclaimer. I used to always say that I'm not an accountant or I'm not an attorney. Now I usually say that this is all as of today, and it can change tomorrow. And what I'm about to say is in my opinion. So, in my opinion, the law could not be repealed today because it would have to go through Congress, Senate, and the President's desk, which obviously the President would not sign. Now, if there was a Republican president in place that would want to repeal this, along with a Republican Congress and Senate, then it could be repealed. So that would be one possibility. And I won't tell you that I'm a expert on legislature, what numbers of votes they have to get those things through, but it certainly is a possibility. In my opinion, what would happen if that were the case, unless there was a very solid plan to replace, so when you talk here about like replace and repeal, unless there's a very solid plan in place to replace this, you would end up with what I would consider insurance market chaos. So, and we saw a lot about this on TV and things like that about the Supreme Court ruling that just went through. So the Supreme Court voted to uphold those tax credits in these gray states. So that's what all the news was about as far as whether or not the subsidies were legal in the gray states, because the law was written to say that it had to be a state-based exchange in order to get a tax credit. So there were about 9 or 10 million people that had a credit from these gray states. And if the Supreme Court would have said that was not legal, we would have had chaos because there's all these people that bought plans, were using federal tax credits to pay for them, and those would have been taken away, which would have made them cancel their plans, which would make the rates for the people that stay go up, which would make more people leave, which would make the rates go up higher, and that they call that a death spiral, basically where the plans start to get out of control. So in my opinion, if you were to repeal the law, you'd have to have some solid foundation for all those people to go to a new plan. And once the plans have gone to a place where you don't have to have medical questions, it's very difficult to go back. It's hard to undo some of the things that have been done. So in my opinion, it could be repealed, but it would have to be done with caution. Yes. So the question is, what kind of feedback have we heard from the insurance companies as well as the providers? I would tell you that the number one feedback that I get, and I feel like I'm in a position to get feedback from multiple people. I get it directly from the insurance carriers. I get it from my clients, and I get a lot of times from providers that have questions. So the number one response to everything I've talked about tonight is confusion. There's so much misinformation and lack of information, and then conflicting information. So from the provider standpoint, I'll answer that first. The providers are very good at what they do. They're in business or in life, their goal is to help people stay healthy. They're not good at insurance. And so when you get insurance very confusing, most of them kind of throw their hands up because a lot of the guys don't know what networks they're in and what networks they're not. And they also have, a lot of other things that they're trying to deal with. So I would say the confusion is the number one thing. From an insurance company standpoint, there's a lot of finger pointing a lot of times. They don't get, they don't get to set their own rules. They don't get to make the plans really anymore. They don't get to make the premiums anymore. And so they have become a little bit of rule takers from the federal government. So, a lot of times they kind of just point back to the federal government and say, we don't know what's going on because they keep changing the rules. That being said, insurance companies, I think, are, they're making record profits. So I think that they've found a way to survive in this world. But I think it's painful because it is just constantly changing. If you try to get, a business up and going, if you're going to make widgets and you set all of your machines to make this widget, and then when you get ready to flip the switch, somebody comes in and says, nope, we can't make those widgets anymore. We have to make these widgets. You have to take apart the whole machine and restart everything and go in a different direction. And I think that's what they've had to do, 3 or 4 times. So the confusion, I think, is probably the number one response you get. Thank you guys very much.